All right. Hello and welcome back to the Can I Get a Refill podcast. We're blessed with another amazing international guest today, all the way from sunny Northern California to discuss a topic that impacts so many of us, including myself. We're talking about addressing mental health issues via gut health from functional medicine psychiatrist, Dr. Tracy McCarthy. Welcome to the podcast.
Thanks so much for having me.
I'm very excited. I've had a few US guests lately, so I'm really excited to have you on the show. And you've got such an interesting career path. And we were just discussing off air about the gut health issues I've had for many years. So it's a topic that's really quite close to my heart and so topical. I don't know, have you heard of a brand called The Beauty Chef? They do sell it in the US there. It's a company I've worked at for a few years. It's like biofermented whole food ingredients that you eat and drink to realign your gut. So it's helped people with eczema, skin, and so it's inner beauty, but it's helping the gut. Mm-hmm. I have talked to customers there for years, and there are just women of every age all over the globe reaching out with gut health issues, and it's just impacting so many of us. Do you find that?
So common. So
common. Yeah, and it's sort of a varied thing, isn't it? I would imagine we're going to get into, but I imagine it's environmental, because years ago people didn't talk about it a lot, but they might not have had the language to talk about it. But also I think life was probably a lot simpler, less technology, less work hours, and perhaps less processed foods. Do you think that was probably part of it?
We certainly have more and more processed foods, and they have a huge impact on the gut biome. And I think the toxin, level just keeps rising in our world, and that has a huge impact on our microbiome also.
Yeah, and then the microbiome just seems to affect everything, your hormones, your mental health. It's just a domino effect, isn't it? So, yeah, absolutely. Yeah. Well, let's start by, if you can tell us a little bit about the work you do and how functional medicine differs to traditional medicine in treating chronic illness.
Yeah, so functional medicine is really all about identifying root causes, and it takes a different approach from the conventional model. The conventional model is really focused on, in the end, it's focused on symptom reduction. And it often ends up being matching symptoms to a diagnosis or a label, and then matching that to a pharmaceutical. It unfortunately often ends there. And so, with functional medicine, it's the recognition that chronic symptoms actually have multiple causes. There isn't just one single cause of anybody's anything, and that we need to look in a lot of places, and that it takes a systems point of view. So rather than these silos in conventional medicine like neurology and cardiology and gastroenterology, it's looking at the whole body, but from these systems like communication, which is neurotransmitters and hormones, or detoxification and elimination, and seeing where are systems out of balance that are then driving these chronic symptoms. And there's all kinds of things, that triggers in life that will imbalance these symptoms. Like I was mentioning toxins, or, you're talking about processed foods, right? And so it's about using these different levers to rebalance the system. And then the systems in the body, when they're working right, your body's going to have a lot of healing, because it's actually always trying to do that. So it's about getting
the body's
out of
smart,
the way.
Isn't it? It's trying to always fix itself, but it might be battling against things that we're doing to counteract that.
That's exactly right. And its wisdom is still way beyond us. There's so much we don't know. But if we can take blocks out of the way of it and give it what it needs, it can go so far. And so it's really that approach to chronic symptoms and going deeper. And of course, we still use all the tools that are in conventional medicine. Like, in terms of psychiatry, medications are a tool and they can be helpful. But the point is to not stop there and to say, well, why is this depression happening? And, whether that, often psychiatrists and any doctor seeing someone with depression would recommend therapy. That's a very important piece of it. But
it's one piece.
Yeah, exactly. What if there's a B12 deficiency? Guess what? An antidepressant pill and therapy aren't going to fix that. So we have to look for all the causes.
We're a human. We're not a computer, and there's just no one size fits all. And I would imagine the clients that see you must. I would imagine you get a few tears in the office because they feel heard. Do you? There's a sort of sense when you're in and out of the GP that you're just not really being heard, and a lot of the times with females, it can be a bit of a gaslighting situation, like your symptoms aren't, because a male doctor might not know. And a lot of medical studies for years were on the male body and not the female body.
Still,
And I went to a doctor a few years ago, a middle-aged male doctor, and I looked like I'd swallowed a basketball, and I was so frustrated because my stomach was always my fittest part. I had a six-pack of abs. And I'm so uncomfortable. Clothes aren't, doing up. I get there and he's like, you seem stressed. I'm going to write you a prescription for an antidepressant. Well, it turns out I had Helicobacter pylori and he didn't didn't ask me about my symptoms. And I was able to treat that and my stomach. And then I saw a naturopath and really sort of realigned my lifestyle and my gut health and got onto a better path. But it's an ongoing thing for my gut health too. I might, things might fall by the wayside and then it starts to, swell up again. So it's something I've always got to look at. But I just felt so not heard, and it did feel like a gaslighting situation. Do clients ever say that to you?
I think that's most of them. I mean, I feel like that's my number one job is actually to have patients be seen, like see them and hear them and validate that what they're going through, they're actually going through. Even if I don't know what it is,
It's like a basic human need, isn't it?
Even if I haven't seen it before.
Heard.
Like they know their body, and why would I not believe them? So that's where it starts, exactly, listening. And also, when you really listen to a patient, you really get a million clues as to what's going on. I mean, one of my best medical school professors always said the patient will tell you what's happening, It
Just
seems really
listen.
basic, but really, if you tune in, it's very helpful. So I think that's super common. The gaslighting thing is real and happens a lot. I mean, people are dismissed because I think for several reasons. One is if it's a problem that doctor doesn't know what the cause is, that's for some people, for some practitioners, that's almost like threatening their ego, or they're feeling like that they're a good doctor. So they're like, they want to dismiss it, or, they'll say like your labs are normal because they just run like a comprehensive metabolic panel, which wouldn't show you anything about the gut really, unless your liver was super not well. So, it happens actually all the time. I'd say that's the norm of the patients I see is they've been kind of banging their head against the wall of the conventional system.
It's so frustrating.
Trying to get answers. Yeah. And
there's nothing more frustrating than trying to seek answers and nothing's working and you just don't feel well. It's really quite distressing. You can't move on.
They're told, it's because you had a baby or you're just getting older, all kinds of nonsense. It's like, no, there's reasons these things are happening.
Yes. And it's your duty to make yourself feel your best. And I've always been a big advocate for just hunting solutions if I have a problem, not just letting it go. It's like, this is diverting, but when I watch Dr. Pimple Popper and people have these giant cysts, now it could be a financial thing, but I'm like, how have you let it go? And they say, it's been there 20 years. How? How could you, I would just do anything.
Standards.
Yeah, absolutely.
Maybe different fears, emotional blocks.
True. Sometimes there's a lot more
let it go,
to
is
it.
what I'm hearing. Yeah.
That's true. Let me ask you, what's the number one thing to know about what's driving our mood or anxiety symptoms?
Well, I think the number one thing is what I said earlier, which is that there's not usually one single cause. But to think in terms of this is a puzzle with multiple pieces, and my job is to try to find as many pieces as I can to my own health. That's really important. So there's probably psychological pieces. There may be situational pieces, like you have a difficult boss,
bad
or
relationships.
Something.
Yeah,
right, exactly. But then there's also physiologic pieces, and I'd say that within, if you could sum up the physiological pieces, it usually boils down to inflammation. Not always, but that's a real common pathway by which these various triggers sort of manifest symptoms.
Yeah, because that can create so many different medical issues. What are some medical issues that inflammation might cause? Arthritis?
Yes.
Yeah.
Brain fog, depression.
Yeah.
I mean, even dementia. I mean, many things. So,
is an anti-inflammatory diet a good place to start if inflammation is in the body? Yep.
Yeah, that would be a great place to start because that's something that is in your own control.
Yeah.
And, you can start with the simple steps. Like I always encourage people just do one baby step at a time so they don't overwhelm themselves, But these little steps totally add up. So if you can say you're drinking soda all the time, well, first just move from soda
that's the
to
first place to go,
water,
surely.
right?
You know what I mean? That's a horrible thing to put in the body. Yeah.
Right. But some people are just, that's where they're at.
They
So that's what they should start.
know. They might just be having a diet that they've had since they were a kid and they don't think until you might point it out, hey, and they just might not know. And then it simply changes. And sometimes it's just that you're used to it. And then after a few weeks or a few months, you might not miss it because
that's exactly right. You just don't know another way. And I encourage people experiment, try this other thing. And then, you realize you like it or it's, it's hard at first, but then it becomes easy.
Yeah.
So it's making these different dietary changes that over time add up huge because that's going to shift your microbiome. It's going to shift your level of inflammation. So it's really a great place to start.
Yeah, it's really important what you said too about doing small changes, small habits, because it can just be so overwhelming and people might just throw in the towel and give up. My husband was, I've mentioned this before on the podcast, he was a PT when I met him. And he said, anytime you'd give a lot of changes, no one will do it. You never see them again. So I would just be like, drink, this many extra glasses of water this week. Then next week, let's implement that. So like Atomic Habits, that book, it's good to just sort of habit stack and do things as you go. Yeah. What are some common nutrient deficiencies that can impact mental health and how can they be addressed?
Yeah, there's several really big ones that are quite common. So magnesium is a really common one. People don't get enough magnesium. It's really not present in the soil, in the food supply the way it used to be because of soil depletion. And I think we need a lot of magnesium when we're dealing with a higher toxic burden. So that's a great one.
Do women need more magnesium than men?
I don't know that I would say that.
Okay.
I think some individuals need more than others.
Sure. And magnesium, as you said, it's one of those things that you can't always get from the diet. That's something that you would recommend supplementation for?
Yeah, I would. Okay. Yes. And then B vitamins are huge for mood and inflammation. That's a huge, that's a big category, but you can get a B complex. It's going to have things like folate, B12, niacin, all these important B vitamins that have a big impact on inflammation and your ability to generate energy in your cells. So that's another
taking all those in my prenatal vitamins.
Yeah.
Yep.
Yeah, very important when you're growing a new human.
Building a human. Yep.
Yeah, exactly. So that's one that a lot of people just aren't getting enough if they're not having a nutrient dense diet, where the food they're eating doesn't have a lot of nutrition in it, then that's going to make a big difference.
What are some examples of some food groups? It seems to affect vegans a lot, does it? B12s?
B12 has to come from an animal source. So, you have to supplement with that if you're a vegan. That's really important. Folates are from dark leafy greens. Yeah. And so that's where you get that. Most of the B vitamins are really readily available in animal products. The folate's the exception to that.
Okay.
Another huge nutrient deficiency is omega-3 fats. That's big.
Yes.
And that has a lot to do with mood and a lot to do with inflammation in general. I like to explain this to people because I think once you understand it, you're motivated to do something about it.
Yep.
We need omega-3 fats and omega-6 fats. They're both what we call essential, meaning you can't manufacture them in the body. You have to eat them.
Yeah.
And, we need both because omega-3s are the brakes and omega-6s are the accelerator on inflammation. And you actually do need inflammation. If you get an infection or you have a injury, you need an inflammatory response to deal with that. But you need it in balance. Yeah. And here's the problem. Most people get tons of omega-6 from their diet because it's in every processed food. It's in all these industrial seed oils like canola oil or soybean oil or corn oil. So every chip and cookie and everything made with those is full of them.
So they're in balance with the 6 and the 3. Is that what you're saying? And what's
so
oily fish? 3?
Yes, exactly. Okay. So like salmon or sardines, that are going to be low in mercury. That's important. You don't just get a lot of mercury trying to get your omega-3s. Yeah. But you need that to balance it out. So I say a lot of folks are like driving around their inflammation car with like pedal to the metal and no brakes at all. And that is so bad for you. And that can manifest as depression. It depends on, your genetics and, how inflammation tends to show up for you. But that's a really big cause. Yeah. And that's why, there's studies that show replacing omega-3s can absolutely reduce depression. So, simple oil change will do that.
Simple change, yeah. Mm-hmm. Sadly, one of the problems is that if you're in a low socioeconomical area, you might not be able to afford, I don't know what the fresh produce is like in your area, but it has almost doubled in price around here. My grocery bill's almost doubled. Mm-hmm. So I do see a lot of families get Macca's drive-through for their kids, but maybe it's. Do you ever hear that from clients, or perhaps not if they're coming to you? But do you think that perhaps a financial issue might be one of the barriers to eating a balanced diet?
I think it absolutely can be a barrier. There are like food deserts, as we call them, where there's not, a store that has fresh produce in a easy, accessible, range for people. That is a problem. But I do feel like the bigger problem is lack of awareness about it, about the foods. I mean, there's no doubt that some people do not have access. I don't want to minimize that. But I think that there's plenty of people who do have access who have no idea that it's important and aren't doing anything about it.
I think they should be teaching this in school over Pythagoras' theorem because I've never needed Pythagoras' theorem, but all these basic, human skills that have been great to hear in school. They should get nutritionists to come in and chat with them. Maybe they do that now. It's been a while.
But here's what's strange to me, going even in medical school, Like, you learn this biochemistry, but no one talked about like
The basics.
why it matters. And I have to say, I studied all this biochemistry in med school, and we all just sort of got through the class and couldn't wait to move on to something else, and we're like, well, we'll never use that again. And we kind of didn't use it again until I did my functional medicine training, and then I was like, I need a biochemistry textbook again, because this is actual biochemistry, and it's so interesting now that I see all the different ways this shows up in people and how we can manipulate this system to help somebody feel better.
Yeah.
It's so impactful, and it's actually so interesting once you
But it
understand
is
the
so
clinical
interesting because it's
aspects.
affecting us day to day,
Yes.
and it could be something like nearly everything is in nature. Like, it's like we have the power to fix it, but we just need the roadmap. So we need people like yourself saying, okay, this is it. I've figured it out. I've got my whiteboard with all my text on it. I've done all the research, and you need to eat this to supplement that. And it could be so basic, but we just haven't been taught that. So
No, we aren't taught it. It's just
No.
and that's what I mean. Like, even doctors aren't really taught it. It's crazy.
yeah, that's so interesting. How does inflammation contribute to mental health issues such as depression and anxiety? I know you touched on that, but if you can talk a bit further about the mental health.
A number of ways. I mean, it's inflammation in the brain. Neuroinflammation is going to be caused by systemic inflammation. So that's the connection with the gut. If there's inflammation in the gut, or you have the bacteria imbalances that are going to be pro-inflammatory, like the wrong bacteria overgrown.
Because you
and
want
not
good
enough-
and bad bacteria, correct?
Well, you want the right amounts of the different bacteria.
balance.
So
Okay.
a lot of people are lacking beneficial bacteria that do a lot of important things for us. We outsource a lot of jobs to bacteria. So if they're not there doing those things, producing those like anti-inflammatory compounds, or they even make neurotransmitters. And if you have the wrong bacteria making all these inflammatory molecules, that's going to impact your immune system and your level of inflammation. And that's going to directly impact the brain. The brain is impacted by the body's inflammation levels. So
Because there's a lot of
neuroinflammation-
talk now, right, with the gut being the second brain and the communication between the two.
Yes.
So the gut health is communicating with the brain, and if the gut's not happy,
Exactly.
it's making the brain unhappy, right?
That's right, and it's a two-way communication street, and there's
Two-way.
there's more than one route in which that's happening, actually. I mentioned the bacteria producing compounds that then are systemic and go to the brain, but the vagus nerve, which is like the longest nerve in the body the longest cranial nerve that's going into the gut and controlling the gut function and digestion, the brain is impacting the gut that way, but then the gut actually is sending information back up through the vagus nerve. And this is wild to me. Some of these compounds produced by bacteria are traveling up the nerve. It's something called chemotaxis. So there's like all these different ways that they're interacting, and it's really
Whoa.
important. Yeah,
Yeah.
they just keep learning more and more about that connection. It's really big.
Because the vagus nerve is a nerve, so I'm not educated in this, so bear with me. So it's a nervous system. So if someone's been under prolonged periods of stress, that would be impacted, right? Because it's your nervous system.
Yeah, that's a really good point. So the vagus nerve is part of our parasympathetic nervous system, which is the rest and digest branch
Yes.
of our autonomic nervous system, which you can think of as like automatic. That's not a conscious thinking kind of thing. That's the part that's in charge of slowing your heart rate. It's important, for digestion. And then the fight or flight part of our nervous system is the sympathetic. That's the other side. So many people, because of trauma or stress, they're
Are
like
in
locked
fight or
in-
flight.
Exactly, like all the time. How can your body even work? How can you digest if you aren't
Well,
sometimes in
society
rest and
feels
digest?
like it's just wired that way, and if you're not in it, maybe you're being lazy or not a good worker. I just feel like if the
That's
whole
right.
society
That's the
seems
message.
Yeah. But it's
And
not in certain parts in Europe. I talk about this quite frequently. My family's from Sicily, and they're just very chilled there. It's not, they have their own problems, but they're not in a rush. And they sit and they break for meals at home, and they sit and
Well,
they
this-
chew slowly.
That's the reason these are blue zones, as they say, with the long
like
lived
Sardinia.
people. I think that's a huge part of it, right? Is that, they're not multitasking over their meal. They're in community. They are talking to people, and they're relaxed, and they're enjoying it, and they're taking it in, and in their mind, they're appreciating it, which supports digestion, and it's just.
But now that feels like a luxury to be out with friends for dinner and to sit, if I'm being a bit naughty taking a long lunch break. It's just so ridiculous. Like I have for so many years eaten at my desk, mainly because I like to spend my lunch break going for a long walk. But it's like we really should be sitting. And I went to a naturopath once that was and it makes so much sense to me that chewing slowly, because you're breaking down the food into very, very small pieces to digest. Otherwise, imagine your body trying to break down big chunks of food. That must be very difficult.
And also the chewing is sending the message to produce stomach acid. So that's like that next step in digestion. So you need this sequence of events to happen. And yeah, if you're just wolfing down the food, you're not actually stimulating that production. So, but we're not all going to take long lunches, of course. But there are some simple things you can do, which is before you eat, like just take a second to look at your food, smell it, like appreciate
mindful
the
eating,
colors of it. And because guess what? Digestion actually begins with your brain. Your brain going, oh, we're about to eat. Let's get ready to eat. And let's get the system
and then start
going.
salivating.
That's right. Let's get the juices flowing. So that's the beginning. And then, take a few slow, deep breaths. Shift your nervous system from fight or flight into rest and digest. It's going to make a big difference. And it's a simple act.
Oh, absolutely. Last week I recorded an episode on biohacking, and we touched on similar things. And I was saying that my whole world has changed since I gave birth to my son. He's 10 months as we're recording this. I just didn't even realize until I stopped how fast-paced my life was, and it was just go, go, go. I just never stopped. I felt like I was in a rush. I had to achieve things before a certain age. And since I've had him and had some time, not that it's a holiday being a mum of a kid, but
they make you slow down. I mean,
they make you slow down.
Priorities are changed.
He pulls me into the present moment when he wants me to be present with him, and I just don't want that for myself anymore, to be in a rush. I just realized, because I have had anxiety my entire adult life, and I realized being rushed is one of the major contributors, and I just want to sit and just really enjoy basic things in life. And I'm trying to strip it back and trying to, blank out my diary and have times when I might just, do some baking, and it just brings me into the moment. It makes me feel so whole. And rest is productive. I'm just better at my job the next day because I've taken that time to rest.
Rest is very productive. I love that. It's so true. And this is a good time to be doing this when you think about what that additive effect of all that stress is. Like, women really start to feel this in their 40s because it really impacts all the hormones. Yes. So that stress hormone, cortisol, starts to impact your blood sugar, your insulin. It impacts your progesterone and your estrogen. And we pay the price. We start losing that buffer faster if we're dealing with a lot of stress. So it's really worthwhile to attend to.
Yeah, absolutely.
What I would add about inflammation impacting mental health is just that inflammation in the brain, that neuroinflammation that's caused by the systemic inflammation, that's going to affect how you produce neurotransmitters, how neurons communicate with each other. The cells around the neurons, called microglial cells, get activated, and that can cause all kinds of problems like brain fog. So there's sort of numerous ways that the inflammation affects just the actual function of the brain and the balance of neurotransmitters. It's going to affect how you feel and how you are able to think, whether you can think clearly or not. So
everyone seems to have brain fog, and everyone seems to supplement it with strong coffee. I actually can't have caffeine. It gives me severe anxiety, but it just seems the norm, the brain fog, doesn't it?
Yeah, it's common, right? It's not normal, but it is common.
Do you know much about ginkgo biloba? Is that good for the brain? Is that something we should be supplementing?
It is good for the brain, but the problem is there's many, many, many supplements that are good for the brain. So, I don't, and the truth is, like, different people need different things. So it's a little hard to give a one size fits all, but it never is. It's one of the things that can be supportive.
Right. Okay. Right. How does gut health influence mood and cognitive function?
Well, first, through the routes I was mentioning with the activation of those microglial cells around the neurons, that inflammation really affects the whole functioning of the brain. But, there's one way we haven't talked about that I think is important is blood sugar, which is impacted by gut health. If you're not digesting fats well or protein well, even if you're eating them, you're not going to be able to balance out the blood sugar spike that happens after a meal containing carbs. And so that is one of the big drivers. The blood sugar spikes is a huge driver of anxiety. So that's we talked about depression, but not so much anxiety. Anxiety really is impacted.
I feel anxiety impacts more people around me than depression.
So, yeah, I think that's pretty common.
Right,
Yeah.
okay.
It's pretty ubiquitous,
Okay.
partly because of what you talked about with like just our
Lifestyle.
the stress, the demands on ourselves. But this is a big piece that people don't realize is happening. Lots of folks are riding the roller coaster of blood sugar where it's going up and down all day. And here's what they don't know is when they have a big spike in blood sugar because, they were either it was heavy on carbohydrates or they didn't have protein or fat with it, or they didn't digest that protein and fat well. They get that spike in blood sugar, and then the insulin that's released to help store that sugar in the cells, it catches up finally to that spike, and now the blood sugar plummets. It gets really low really quick, and guess what your body does when your blood sugar drops rapidly and precipitously? It releases adrenaline. So then you have this adrenaline surge, which of course is anxiety inducing. It feels like anxiety, physical anxiety in the body. And so, a few hours
So
after
if
you
someone
eat,
says that they're
can happen.
hangry, if they're hungry, angry, is that could be the blood
That's
sugar?
definitely part of the blood sugar thing. That's like it's dropping before they eat, and they're like, because they went
need
too
food now.
long and they can't sustain good blood sugar without like frequent meals.
Okay.
That's definitely
So-
part of the insulin resistance problem is people where they have to keep eating all the time little meals.
So
The
is
other-
one of the ways that people can fix that is to plan their meals out and have it more balanced. So if someone is not having protein with their breakfast, they're going to want to snack in between breakfast and lunch a lot more.
Absolutely. I
Okay,
feel
so
like
a
we see
balance
this-
of carbs and protein.
Yeah, you just got to make sure there's protein at every meal and some healthy fats at every meal and every snack.
Yes.
That's just,
Yes.
I see this all the time that people just aren't having it. And I'm not saying you have to have high protein, but you have to make sure you actually have adequate protein at every meal. And then.
Well, some people just don't know
that's
what's
gonna help.
adequate for
No.
them. Yeah.
No, but like so many people just have none, like no protein with their meal.
Right.
And so there's a lot of breakfasts
carb
that
heavy.
fall into that category, right? People having
Oh,
cereal.
think of
or
the
something.
sugary cereals we grew up with in primary
Right.
school. Like,
Exactly.
there's no way that would fill me now. And I had this very odd pregnancy cravings where I went back to wanting things like that. And I was like, how did I used to eat this? I'm hungry 10 minutes later, as opposed to having my favorite breakfast, to having oats with some peanut butter in it for the healthy fats and some fruit, or sourdough with avocado and a poached egg is like my favorite.
Exactly. Protein and fat is so important. And actually, if you're somebody who has blood sugar problems, starting with the protein, eating several bites of that first is going to help even more to balance that
interesting.
out. Yeah, these
that's
little simple things make a huge difference. And you can
Yeah.
have calmer blood sugar. You're going to avoid a lot of anxiety. It's amazing how many people notice a reduction in anxiety when they make these changes. And one thing people don't realize also is often this blood sugar drop can happen overnight and cause them to be waking up at like 1 a.m. or 2 a.m. or 3 a.m. And they have no idea that's happening. And they wake up and they're just awake. And it takes them an hour to go
I'm
back
not
to sleep.
surprised. I watched a sleep study once and they filmed 3 different people. One underate, one overate, and one ate the right amount. And the people that were hungry or ate too much tossed and turned the whole night. And the person who ate the right amount at the right time had a very steady sleep. So it's just impacting every area of your life, isn't it, the diet?
Exactly. And you're making sure that you're actually having that, again, that protein and those fats with dinner so you can be balanced through the night. And that's a simple change. Like when we fix that blood sugar thing, people sleep so much better. Anxiety reduces a lot, so, and here's the thing about that. This blood sugar problem is a big problem societally. Like it's a driver of so many problems: high blood pressure, fatty liver disease, polycystic ovarian syndrome. Just the list goes on and on. It's one of the big reasons people end up with Alzheimer's is the glucose toxicity in the brain. So it affects everything. And so if we can get our blood sugar under control and take care of ourselves in that way.
I don't think people are talking about that enough. I feel like if more people knew that, they'd make little
It's the
life
low
hacks.
hanging fruit, But the problem is our, at least here, in America, grain production is subsidized. It's like it's everywhere. The cheap foods are these carb heavy, nutrient, depleted foods that are not helping our levels of inflammation and supporting a balanced blood sugar.
Yeah. It's availability and it's education, as you said. If people knew, they might be making healthier choices. What are your top practical lifestyle changes that our listeners can implement today to help improve mental and physical well-being? You've touched on some already.
Yeah, so anti-inflammatory diet, right? Just to elaborate a bit on that, that's like really trying to reduce the processed foods. And we're not saying like never eat them, but just what are you doing most of the time at home? That makes a huge difference. So can you cook instead of like eating out of like microwave food or packaged pre-made food?
All right.
That's
So
gonna
what
make
are
a
the worst
difference.
things? What are the most inflammatory foods you can have? Are there certain types of oils that are more
Yes.
inflammatory? Which
Yeah.
ones?
So it's the cheap oils that are from grains. So that's canola oil,
Canola, sunflower.
which is also originally rapeseed oil. That's what it's called. And there's a high oleic sunflower oil is not too bad, but most sunflower oil is not great. Soybean oil is cheap and bad for you. Corn
And when I
oil.
read packaging on like prepackaged foods, they all use the cheap.
Yes,
and I'm
these
like,
oils.
even hummus. I love hummus, but I don't really have time to
Yes.
make it. And I'm like, can people just put olive oil in their food? Because my
Yes.
body loves olive oil, and they're all doing the cheap oils, but every other
right.
ingredient's great.
I know
Yeah.
I've been there reading the hummus and I found the one brand that has the olive oil in it. That's the one I get, because it makes a big difference.
I've recently found one too.
Doing the oil change is big. If you can supplement with omega-3s like a high quality fish oil or eat the fish and
Yeah.
then really reduce those oils in the processed foods and like the salad dressings. Almost all the salad dressings
Yes.
have these in them. So
Well,
there's a
I
few
grew up. My
brands-
dad always just had olive oil, bit of vinegar, lemon juice. That was it.
Yeah,
That was
perfect.
yeah,
So easy to do. Yeah,
and it's
that's-
tasty.
Yeah, and there's a couple brands that use avocado oil, and that's great. But mostly it's bad. So like making those changes, that's huge. So that's the first thing. Like that, thinking about whole foods, make
Yep.
sure that you're getting healthy fats, adequate protein. That's an anti-inflammatory diet. Eating the rainbow of colorful fruits and vegetables to get that's because all those colors are made of phytocompounds or phytonutrients that feed our microbiome. So
Right.
get beneficial bacteria and the fiber in there, so important. So
Yes.
that's for the gut. And then, key supplementation, like I said, magnesium, omega-3s if you're not eating the fish, B vitamins if you're not getting enough of that from your food. Sometimes zinc is another thing that's commonly low
Yes,
that
I
people
hear
need
that.
to
Yep.
supplement with. So those are also really important. And then I think another one that people don't realize is to think about their light exposure. So this is big because it impacts the cortisol pattern during the day. Okay, so cortisol is a stress hormone. We release it when we wake up in a big surge, and then it slowly goes down during the day. And then we should have melatonin being released at night, and they kind of take turns. And a lot of things flow from that rhythm of those hormones. And our brain uses light cues to decide when is it morning and when do we release the cortisol. So if we
We're
aren't
confusing
getting-
it.
Yeah, so if we aren't getting outside ever and not getting that bright daylight, even on like a cloudy day, being outside for 20 minutes is going to be way brighter than any indoor light, even though it doesn't seem that way to us, it actually is.
Yep.
So that's telling the brain, okay, this is morning. And what we do is we don't get that exposure, but then at night we watch our big like LED TVs and we are on our screens and our phones a lot, and that tells the brain, oh, it's morning. And it's not morning. So this really messes
That's why no
things
one's
up.
sleeping. I had
one of
the
the reasons,
loveliest.
yes.
I bought my son a book yesterday and had the loveliest chat with a woman in there whose two daughters are grown up, but she said she always prohibited phones, at certain times when they were younger, and she said they hated it then, but they thank me now. And I'm just hearing of teenagers not being able to sleep. Now, listen. If there was any time in my life where I had a great sleep, it was when I was a teenager.
right?
I would sleep 11 hours at night. But phones came in when I was 15, in 98. I remember I got my first Motorola brick, and it was just all you could do was text or play Snake or whatever, or Nokia, whatever it was. But now, she was saying, these friends are messaging each other at 11 p.m. They're just rolling over and looking at their phone. How can they sleep with that light exposure?
No, that's really true. So being mindful about that and just aware that that's kind of one thing to kind of just have in mind. Like, did I get any light? Did I get light at the right time? Because there's this whole domino effect from your brain to all your hormones, and it makes a huge difference in mood and, having a healthy circadian rhythm. So that's another hack
Yes.
that I think is useful.
Great life hack. Again, simple, just need the tips on it.
One other thing I'd say for reducing inflammation, that's just an easy tip, is get moving. And I don't necessarily mean like hardcore exercise. Of
Could be a
course,
walk.
like intensity, high intensity interval training is so good for you. And so many things you can do with strength training that's going to help your muscles, which will help your brain. But just moving, walking, not sitting all day, getting up and doing a few air squats in between meetings or something, just real quick. This makes a huge difference. This really impacts your brain and impacts your mood. Exercise is one of those things that's what we call a hormetic stressor, which means the dose is really important. If you get way too little, you're going to have more inflammation. It's a stressor. If you have way too much for your body, whatever's, the burden on your body at that moment, kind of your stress bucket, how much can you handle? That's also a stressor. Like when you're a brand new mom and you're, maybe you're also dealing with a chronic illness or something, it's not the time to train for a marathon. Like that's too much.
I completely agree. There was a time when I was working in the city and I had to get up. I used to wake up at 4:15 every day, go in the dark, go to a gym workout. I was so depleted of energy that it felt horrible. It didn't feel great. And I love exercise. I've exercised my whole life. Then I got a bit older and I was like, you know what? I'm going to snooze my alarm to 6:30 and rest. And my body felt better. And I didn't gain weight overnight from not having that. It honestly did myself a service by having that rest, because my body was saying, Steph, I'm tired. I'm depleted. You're not going to get a lot out of this exercise. But it's true. Listening to the body is key. Yeah,
that's exactly right. And the thing that's right for you in one season of life or even one day is not necessarily the same as the next day. Like the night you didn't sleep well, that's not the next day you want to go hard at the gym. Right? It just, listening is really important. So, but like I said, if you're not getting any exercise, that's also a stressor. You got to move. Our bodies are designed for that. So that really.
That's why I hate flying long flights, because I love to move. I'm always the girl at the back of the toilets doing squats because I need to move. Look, you've really given us so many helpful hints for people to take away today. Very practical, very simple, but again, just not the education out there. So it's very important the work you do to pass on that information. And I can tell that you've really had a positive impact on your clients. So I wish you were in Australia. Finally, I just want to ask you, because this podcast is Can I Get a Refill? We're all about filling up our energetic cup. What is something that you'll be doing in the next week to fill up your cup?
Well, it's, as we're recording this, is the end of my week. It's the end of Friday of the day. So I'm thinking about the weekend. And I guess for me, one thing I really adhere to pretty well is I don't work on the weekend. I really try to switch gears. And even when there's projects that aren't done, it's like time to give my brain a break from that, be with family, be outside, do fun things. And that always makes all the difference for going back the next week and being ready. Like you just need that shift, that, and I think trying to just pedal to the metal all the time, you burn out. So I think just recognizing, well, it's like you were talking about, taking that pause to bake, Yes. Like we have to go in and out. Rest is productive, like you said. Yes. It's really, really important. So
absolutely.
That's what I'll be doing this weekend.
Good on you. And it's very funny that you should say that. Literally last night I said to my husband, so I've been working a full-time job. I went back to work when my son was 5.5 months old. And then I've been helping my husband with his business. I've been doing my podcast. I work 7 days a week. I don't switch off. And I said to my husband, I've recently resigned from my job and we're going out on our own. It's very exciting and it's very scary, but it's been the right choice for me. And I'm really, in your body when you've made the right choice, because my shoulders, the tension knees, I felt like, okay, now this is what I need to do. And I've made a conscious decision that weekends will not be about work. So I will definitely switch off. I've even put a little out of office on my emails. I don't know if you saw it, saying, if you're contacting me, please expect a 1 week turnaround, because I just have so much on. So smart. And now that I have a little baby looking at me, I always say to my husband, remember, our weekends are his childhood. So I really want to be out in nature, making the most of it. And I don't have it. My husband and I, we're always on. So there's no... You remember when in lockdown everyone was working from home? It was very hard to differentiate home from work. Yeah. So
it was not good for that. I mean, it was good for like, I can get the laundry done while I'm working.
True.
But that's right. Then work never ended. And that was not good for people.
Exactly. And I was working with a gentleman at the time who said at 5 p.m. I'd shut the laptop, go outside and go for a walk for half an hour to symbolize this is the end of the work day. So it's really important. So I just want to make a really conscious decision once I've still got a few weeks of work, to really differentiate work from non-work time and to put that time in, and not just for my son, but for me, because I'm just a better mum when I fill up my cup.
Right, and like time to get together with a friend or dates with your husband. Like this is really important. Like that's what fills your cup and helps you keep going.
But you don't realise when you're caught up in it how much you've neglected that. And I think it was last Friday I went out and had, because I don't really go out at nights now since I had my son, and my husband looked after my son, and I went with 2 friends I've known for 25 years, had a dinner that went on for a few hours, and I'm normally hour and a half, I'm out. It was so good for the soul. Then I caught up with some mum friends with our kids at the park the next day. My cup was so full that I went to bed doing my gratitude list, just feeling so ready for the week, but just grateful and not burnt
Exactly.
out. Yeah. And
those
it's
things are so important, so important.
so important, but it's up to us. So I can't blame anybody. I'm always saying to people, you're in charge of your diary, so you make sure you do those things. So yeah, so important. Well, you enjoy your weekend. It's Saturday for me. I'm off to go out and have lunch with my husband and son. So you enjoy your Friday night.
Enjoy yourself.
And thank you again. It's been super, super helpful and really lovely to meet you. And
Thanks for
everyone,
having me.
please take a leaf out of our book and do something in the next week to fill up your cup.